Thanks for watching Conversations with Dr. Allen. Today, I'm going to bring you as close as you possibly can get to the data associated with the new surge in the coronavirus. I also have a 3-year-old child who tested positive for the coronavirus. Let me show you some of the results. On the date that we tested the 80 patients, which was on 7/8/2020, I purposely separated out the 5 positive cases that's associated with that batch of samples for that day. Also, there is one individual who's indeterminate, of which I will tell you how to determine or how to interpret an indeterminate sample if your name is ever associated with an indeterminate coronavirus test. Now, I'm bringing the diagram out to show you how to interpret the data of that day, which is 7/8/2020, regarding the 80 people that was tested. Please keep in mind, we saw more people than the 80 exemplifies. However, there was only 80 people that was tested that day within the clinic. 5 of the people were positive. 5 times 16 equals 80. Therefore, if I take a group of 16, one group, another group of 16, 2 groups, another group of 16, 3 groups, another group of 16, 4 groups, another group of 16, 5 groups, 1 out of every 16 people tested positive on 7/8/2020. Which means if you're in a group of 16 or more, there's a high chance that someone within that group is positive for COVID-19. Remember, my sample represents a microcosm of what's going on a global scale, but it gives you a clear eye view of how prevalent the disease is now. I'm going to discuss with you how to interpret an indeterminate sample if you received that result. Please take a look. On this same day, the individual, which is 7/8/2020, had an indeterminate sample, and an indeterminate sample is read as a presumptive positive and treated as a positive. Let me discuss it with you on the board. Using this example will help you understand how to read a COVID sample. A sample introduced at this level goes into the machine. When it hits the first threshold, it says there is a COVID infection. Does not determine which one at this particular time. It's just that's the first line or first reagent used, because it's double 2 are used to say, yes, we're dealing with COVID. For this particular virus, we're dealing with COVID. Now, as we move from COVID to COVID-19, this area here only displays that we are still dealing with the virus, one of the 19 viruses. The second threshold in the testing equipment is for COVID-19. It's here, the threshold, if it's just right here, is said to be indeterminate. Which means we can't say if you're going on the early rise of the illness or the virus infection, or are you coming down from being infectious. It only tells us here that you're at the threshold, and it's indeterminate whether you are truly going in a positive direction or truly coming out of that particular infection. Thus, the interpretation of indeterminate. Remember, anything under here is perceived as 100% negative. Anything above the threshold we call 100% positive. Now we're going to bring in the family member to talk about her son and the child who's 3 years old that tested positive for the coronavirus. Today we have our youngest person yet, a 3-year-old individual who's tested positive for the coronavirus. I have his mom here today to speak on his behalf and what she's been going through. This virus is really spreading. This is done to make sure you guys start taking the appropriate precaution to take care of yourself. I'm going to ask Ms. Williams to come and speak to the audience if I put my mask on, and she's going to speak from her heart on how this is affecting her life, her other kids, and the daycare of which your child is going to. Ms. Williams, will you please come forward? Here's your child information. If you can please let the audience know what you're going through.
My son is yet the youngest kid that's been tested. I'm just appalled and I'm it's just devastated that I have to deal with my 3-year-old having COVID-19, and I don't know what's the position to the rest of my kids and my mother. My mother has the underlying disease. It's causing more drama. It's causing me to have to fear my daycare closing. It's causing disbelief. It's causing the people to blame each other. This is serious. The licensed daycare I have them in, their parents and their family got underlying diseases. They too, the people that works for them, go home to people that got underlying diseases and on their deathbed. And I just don't know. When my son wake up in the morning and say he got a stomach ache, and then, I say, okay, go boo-boo or whatever. He goes, boo-boo, walks out like everything is okay, run, play, he hop in the car, go to daycare, and the next thing you know, he have 104-degree temperature. It's wild. So I'm here to let y'all know, protect y'all kids. Wear a mask. Wash their hands. If you got to, just don't go nowhere until it's all over, because it's no joke, and it's really hitting in the communities, the communities that don't have anything, the poverty community, the people, the lesser fortunate. And it was fortunate enough for Dr. Allen to help me get my kid tested. And I want y'all to know that if it wasn't for Dr. Allen, that I would have never known my baby had COVID-19. Dr. Allen, when I only had enough money, he put in the other half. He got my kid tested, and he got the results back to me within a timely manner. And I want to thank this man. This man is no joke. This man, I've been coming to this man for 10 years. Even though I got medical insurance, and I could go to the hospital, and I could go to their pediatrician, I go to this black man right here, Dr. Allen. He got 7 clinics. He's the only one I trust. He's just not a billboard image. He's a real person. And he cares about the community.
Thank you, Ms. Williams. As Ms. Williams spoke from her heart, this virus is no joke. It's important that you guys listen from the patient standpoint, even if you're not the physician. Protect yourself during this pandemic. Thanks for watching Conversations with Dr.